Respect it, I mean, we network across the globe, cause it's a global market in case you didn't know. And since we all about information flow, let me be the first one to welcome you to Tech Zone with Paul Amadeus Lane. Let's talk tech, cause technology changing the game. It's all good in the hood, it's everywhere. Now let's get to the show, cause we live on air, yeah.
Welcome back to our second segment here on the Tech Zone. I hope you enjoyed our first segment. Veronica Botsgraf was just amazing talking to us about journaling when it comes to nutrition and the technology out there that can help us out to do so, because we have to stay healthy. Now, some of us have neglected our health, but around this time of year, there's something going on. Open enrollment when it comes to insurance. So now we're like trying to get, okay, I need to do some, am I healthy, am I this and that? So our next guest coming up is going to talk about that, about how we can navigate through all the roads when it comes to this issue. So we're going to be joined by him in just 1 second. But remember, you can always connect with me, paulonwheels.com. That's paulonwheels.com. And let me know how you're feeling, how you like the topics. Connect with us on Facebook, Twitter. That's the best way to do so. But my next guest joining me is going to help us talk about the issues of trying to find the best insurance plan for us and our family. And we are so happy to have him join us today and talk about this very, very important subject. We're talking about Michael Levin. He joins me now here on the Tech Zone. He's with a great company out there. He's CEO and co-founder of Vericred, joining us. How you doing, Michael?
I'm well, Paul. Thanks for having me on the show.
Hey, so tell me about navigating through all the big, thick binders that you get from your employer when it comes to open enrollment. What's the frustrations that the ones have out there when it comes to try to choose a plan?
Well, I think historically the frustration has been a lack of transparency and an understanding of what the plan offerings are. As individuals, our cost of healthcare is one of our most significant expenses, and certainly as an employer, it is. And as we pay more for our healthcare, our health insurance, as we reach into our pocket more, we want choice and we want transparency. So we want to be able to choose the right plan for us. And that's not been terribly easy. So what we do at Vericred is we make the data available to our partners so that they can provide transformative shopping experiences, something as simple as what we would be used to in buying a TV set or a car, bringing that kind of technology to healthcare.
You know what? I'm so glad that we're talking about this. I'll tell you, my wife, when it came time for her choosing her insurance, all you did is like, check this box, let's just go. And I'm so glad that we're talking about this, because sometimes you can get in a plan that doesn't fit you, that you end up coming out with more out of the pocket cost. And then you're like frustrated because really once you're in a plan, you're kind of like stuck until the following year, correct?
No, that's correct. When you make a selection, whether you're in an employed environment or an individual environment, you're there for a year. So you have to make sure it's the right plan. So just so your listeners understand, your viewers understand, there's some folks that will buy insurance through what's called open enrollment on the individual market. There's a lot of press about the Affordable Care Act. And the good news here is there's a lot of choices. The challenge here is navigating those choices. Now, if you're employed, it's a little bit different, because you're going to be limited by the choices that your employer puts forth. Now, the good news here is that more and more employers are offering a choice where years ago it would be very patriarchal, that you would only have one plan that you could choose from. So really there was no choice.
And Michael, how did you use technology to kind of bridge this gap, this void that's out there? Because everybody, I think, feels a frustration when it comes to this. When did you know that, hey, I'm going to take technology and I'm going to make this a little easier for ones out there because of the frustration that I might have had?
Yeah, so this was born out of a personal experience. A couple of years ago, I was on healthcare.gov trying to find a health plan for my family. We're a family of 6. We have 5 doctors between the kids' pediatrician and my wife's OB and my internist and an allergist. And I simply wanted to find a plan in which my doctors participate. And there was no way to do it. So what I thought was going to be a 15-minute exercise on a Saturday morning ended up taking 6 hours of going through all these different plans and going through to each carrier's website and looking at my doctors one at a time. And the problem here, after some investigation, was that the data didn't exist all in one place. So there was no way to build this kind of functionality. So that's where we started out. And today, we offer data so that others can build modern shopping experiences so that you can put your doctors in and see who's in and who's out, so that you can put your drugs in and see if they're covered in what tier levels. And this has been in the news just recently because of this whole EpiPen issue, that the cost of drugs is a significant factor. And you can look at different plans and know which one is right. I'm 51 years old. Co-founder here is 33. The plan that Dan needs as a 33-year-old is much different than the plan that I need as a 51-year-old with a wife and 4 kids.
And we see a picture of Dan right there too, and you guys make an awesome team. And when it comes to healthcare, it's something that I think if we knew more about it. You talked about the transparency issue. If we knew more about it and understood it, I think the frustration that we have would kind of be less aggravating, because look what happened to you on a Saturday. I mean, it's college football season. You don't want to spend hours on healthcare.gov trying to find out. You want to watch some football. You want to hang out with the family. You want to do some relaxing things. And I think taking the frustration out of it is, I tell you, it's worth its weight in gold.
Yeah, it is. And to take you through some of those examples, today now, a shopping experience should be entering your doctors, entering your drugs, perhaps even entering some of the conditions. I'm going to have a baby next year, or I have asthma, and have an experience where recommendations can be made. And this is starting to happen. It's happening in the individual environment. It's happening in the employed environment. And it's moving into the senior environment where many of these issues are so critical. So the good news is that because of our role in this whole ecosystem, because of the availability of our data sets, that we're enabling this transformation. And finally, people can make sense of it. And there are great tools, great shopping experiences to be had now because of that.
All right, Michael, let's play geek out for a minute, okay?
Sure.
Let's geek some of our friends out, because I know I'm a geek. A lot of my followers are geeks. So let's talk about how Vericred delivers a complete and structural health plan design and rate data provider and all the nuts and bolts. We have an image right there. Why don't you talk us through that, please?
Sure. So it all starts with getting all the data together in one place. And we have 3 core data sets. We have what we call plan design and rate data. And that talks about all the details of a plan, who the carrier is, what the plan name is, to whom is it available, what does it cost, what does it cover, what are the deductibles, all that kind of stuff. The second data set is provider network data. That speaks to who's in and who's out of each plan. And then the third set is formulary data, which speaks to which drugs are covered and at what tier level. So the first job is bringing all that together. And to give you a sense, there are literally over 1,000 different insurance carriers covering these different markets. And there is, or prior to Vericred, there was no central place where any of these data sets, let alone all 3, existed. So we bring in data from in different forms and formats from all these different carriers through different means, and then we make it useful. So that gets into that next step. So we have to standardize the data so that our partners can build products on it. We have to solve problems. One of the examples that I use is, there are no rules or standards on how an insurance carrier describes a plan, or a benefit. So in one instance, seeing a primary care doctor, your physician, it may say $25 after deductible. In another case, it may say deductible, then $25. A third, it may say deductible, then comma $25. And as a user, you want to see all that information in a consistent format. So that's part of what we do. And it also helps if you're sorting or filtering plans by those different elements. So that's that data cleansing and normalization. And then we make it useful. Our customers are technology companies that are transforming the way health insurance is quoted, sold, enrolled, and increasingly utilized. And these technology companies want data through an API. That's an application programming interface. They want structured data. They don't want to have to worry about all of that. That's what we do. We're the data layer on top of which others are building features and functionality and user experiences.
Awesome. And then that takes us to our the data distribution, where the insurance, the apps, and all the other things are there. So that's where the consumer comes in, and look at all the hard work that you guys put in, right?
Yeah. So, I've talked a lot about finding a health plan, and it's critically important. Our user research shows that in the absence of a meaningful shopping experience, they'll buy the most expensive plan that they can afford, assuming it's the best. And that's not the case. It doesn't have to be the most expensive plan. It just has to be the right plan. There's a lot of talk about provider networks, doctor networks that are getting narrower, and there's a lot of press that sometimes these are bad. They're not necessarily bad. It's about the fit that counts. If you can find a narrow network with the doctors that you want to see, then that's a great network for you, and you can save 15 to 30%. So a lot of time on shopping, but there's other uses for this. So physician referrals. On an annual basis, there's millions of referrals from primary care physicians to other specialists. And a recent survey by another company found that as individuals, as patients, we're more concerned about whether the doctor we're being referred to is in our network, so we don't have to pay out of pocket the full list price, than we are of the clinical competency of that doctor. Kind of a stunning fact, but our network data powers that. So you don't have to make a choice. You can look at both. There are applications being built around helping you use your insurance better, tracking your deductibles, finding new doctors, understanding what a drug will cost, understanding what a procedure will cost. Maybe they even integrate with your Fitbit. Our data supports those types of applications as well.
And Michael, when we see the way that technology is today, I mean, it is phenomenal that we can do something like this. And in your wildest imagination, and looking at your background, this is, technology is something that you definitely are been interested in for many years. Did you ever foresee that this would be the norm now, that we're able to do this just on a device or on our computers, they were able to tackle this?
Well, I think health insurance in particular has been, has been a departure from the norm. As I said earlier, think about how you buy a house, how you buy a TV, a car. You shop online, you compare specs, you can look at sizes of screens and colors of car. And until just recently, you couldn't do these very basic functions in buying health insurance. And if you're someone in the individual market, this is a significant expenditure. Typical family plan may cost $10,000 a year. So where else do you spend $10,000 a year without having tools to be able to do that kind of research? Well, it's happening now.
And we are so happy as a consumer that we have this that can help us out. And before we talk about more how the consumers out there can really take advantage of this service right here, I want to delve into I got your bio here, and what I'm thinking is amazing. Digital imaging, how you started several years ago, and where it's at today. Does it blow your mind?
Oh yeah, I mean, this was a different life for me. But when I started that company, a company then called Catapult Graphic Systems, color printers were $25,000. It took 4 minutes to print a page, and it cost $4 to print that page. And now you can essentially get these printers for free. They're fast, they're ubiquitous. I enjoy the whole transformation that industry went through. And in fact, my role in that industry was bringing quality, value, and choice to that industry as well. And it's really not much different than what we're doing in health insurance. Through our data, our partners are building tools that provide for transparency, allow people to make good choices so that they can get quality health care. So, despite being two very disparate industries, I think there's this kind of undercurrent in what I've done throughout my career.
Awesome, awesome. So, how can viewers, listeners out there, find out more information about Vericred?
So you can certainly come to our website, which is www.vericred.com. But again, we're a data company. What I would advise your viewers is there are tools, there are experiences out there where you can have a complete shopping experience, where you can compare side-by-side plans, where you can see whether your doctor's in or out, whether your drugs are covered. So don't be satisfied with that single option. Don't be satisfied with a broker showing you two choices when you're shopping for health insurance. Look for that experience. It exists out there today.
And before we let you go, is there any other information out there you would like to articulate out to the audience out there that we neglected to talk about so far?
No, I think we enter into open enrollment, it's important. Some of the important elements are your doctors covered by the plan? Because fewer and fewer plans are offering benefits for out-of-network doctors, so it's important to find a plan in which your doctors participate. A lot of the media has shown a light on on EpiPen and how important what are called formularies are in that process. If you take drugs, and more than half of adults take prescription drugs on a regular basis, check to make sure that those drugs are covered. Check with your physician to see if there's a generic alternative, which is more likely to be covered and also less expensive. And look at what kind of care you think you may be needing over the next year if there are life events, if you're having a child, if you're having a procedure. And then beyond it, I think today, while most Americans now are insured with health insurance, they're underinsured with long-term disability insurance.
Mm-hmm.
And, I would encourage folks looking as they're entering open enrollment, to also consider long-term disability. Because if you do have some kind of unfortunate incident where you're out of the workforce, while your health insurance will cover for your care, it won't pick up the income that you would otherwise lose. So we're really passionate about that. That's not an area that we're involved in today, but we do encourage folks to look for a balanced set of coverage.
Michael, I'm so glad that you brought that up. 23 years ago, I became a quadriplegic, and I couldn't do my job anymore as an emergency medical technician or a musician. And I wish back then I took the long-term disability insurance, because I had a rough spot, but I'm on my feet now. But you hit it spot on when it comes to we never know what can happen to us.
Yeah, and quite frankly, it's fairly inexpensive insurance in the scheme of things. You're better off shopping for the right health plan, finding the right fit, which perhaps can save you a couple of dollars, and put that money into that long-term disability.
Michael, thank you so much for joining us on the Tech Zone. Enjoyed talking with you, and we look forward to having you back on again and talking more about other things that you guys are doing over there at the company. And keep up the great work. And as a consumer, I say thank you, my friend.
My pleasure. Thanks for having me on the show, Paul.
Again, we thank Michael Levin, CEO and co-founder of Vericred. We know open enrollment is happening, and I know some of you out there, seniors who may be on Medicare, or you listeners out there, if you're father or mother, disabled family member, or someone out there who's on Medicare and the Affordable Care Act, we're going to have Michael on a little later on in October to talk a little more about navigating through this. And please send me your questions, and I'll pose them to Michael, and he can answer them for us. All right? Put him on the spot, right? Hey, when we get back, don't forget, one of the biggest social media personalities will be joining me in the third segment, hopefully, if we get the technical issue worked out. If not, you're going to have me. Just me, yes. We'll be right back here on the Tech Zone. I'm Paul Amadeus Lane. Be back in 2 and 2.